Hello, my name is Alyssa Giancola, and I am the Account Director at Regen Med. This will be a brief presentation covering clinical surveys and accessing inCytes. There are a variety of ways in which a physician can complete their clinical surveys. Alerts will appear on their dashboard to complete their surveys. Physicians can also select cases from the left-hand menu and see their registered patients. Here, they can view their patients' responses to the survey and see the observational protocol and corresponding surveys. Physicians do have the ability to complete their clinical surveys within a case. They can simply select the appropriate survey they wish to complete. This protocol is for total knee arthroplasty procedures. There is a pre-operative survey, operative survey, and a variety of post-treatment surveys the physician will complete. Let's review the pre-operative survey first. The pre-operative survey can be complete at the medical evaluation visit and/or at the anesthesia evaluation. The use of narcotics is a data point that is required by CMS. If yes is selected, we will ask you to indicate which opioids the patient has been taking. We also ask physicians to indicate knee range of motion metrics that will be useful for comparison later during recovery. The Medicare provider number, MBI, date of hospital admission, date of procedure, and description of procedure are all matching variables required by CMS. All questions in the clinical surveys are optional to allow for flexibility. If you cannot complete the survey in one sitting, you can click Save at the bottom of the survey and always come back. This survey took less than 1 minute to complete. Now let's take a look at the operative survey. The operative survey collects a variety of information around the surgical techniques used during the TKA procedure. Follow-up questions will appear when appropriate. As you can see here, we have all of the matching variables that CMS requires at the top of the survey. Then there are more specific questions about the treatment, like the knee that was treated, and about patient conditions like comorbidities. And if the patient is receiving any other adjunct treatments. The survey then asks you to provide more information that are very specific to the procedure, like anesthesia. Here we ask you to provide information about the implant itself, like the manufacturer and the serial number or lot number. The next few questions dive into more details around the surgical techniques and what happened during the procedure. Here we ask about surgical assistance, surgical technique, if a tourniquet was used during the procedure, how the tibial and femoral components were fixated, which will then have follow-up questions when applicable if it's a hybrid fixation. Other questions more specific to the knee, like patella resurfacing, any primary alignment strategies used, management of the PCL, and finally, any ligament releases or adverse events that occurred during the procedure. This survey took about 2.5 minutes to complete. Finally, let's take a look at the post-operative surveys. The post-operative surveys are due at 2 weeks, 6 weeks, 6 months, and 12 months. The surveys are relatively short, collecting the matching variables and knee range of motion, if applicable. As in the preoperative survey, we also collect BMI. This is mostly to keep track of the patient's progress and to also account for any confounding variables. Collecting the knee range of motion metrics at these time points will allow physicians to track the patient's progress throughout recovery and understand if they are meeting expected milestones. As with all other clinical surveys, the required CMS matching variables are here for the physician to complete at their convenience. This survey took less than 1 minute to complete. You will receive an email once a week that will bring you to your tasks, which will contain all the surveys that are due. You can complete any outstanding surveys by simply clicking on the task and completing the survey accordingly. To access inCytes, you will simply log in using the credentials you used during registration. After logging in, you can see which circles you are enrolled in by clicking on circles on the left-hand menu. Here, this physician is only enrolled in the total knee arthroplasty circle. Physicians will be able to access their account from any device at any time. All information is securely maintained in the cloud. When multiple physicians are enrolled in a circle, you will be able to compare your aggregated patient outcomes to all the other aggregated outcomes of physicians within the same circle. The blue bar represents the average knee flexion at 0 days and 2 weeks of all your patients in the circle, while the black bar shows the average of all other patients in the circle. This is an easy way to directly compare how your patients are performing against other physicians. Thank you for your time. I hope watching this video was helpful in understanding what your experience will be like when participating in MOTIV. Please reach out to your account manager if you have any questions. Thank you.